Understanding bronchitis: causes, symptoms, diagnosis, and treatment. Bronchitis is an inflammation of the bronchial tubes, the airways that carry air to and from the lungs. This condition can cause swelling and mucus production, leading to coughing and breathing difficulties. Bronchitis is typically classified into two types: a short-term condition often caused by viral infections. Symptoms last a few days to a couple of weeks. A long-term condition that is a component of chronic obstructive pulmonary disease, COPD. Symptoms persist for at least 3 months in 2 consecutive years. Commonly associated with smoking and exposure to environmental irritants. Acute bronchitis causes: viral infections. Most cases are caused by viruses, such as influenza or the common cold virus. Bacterial infections, less common, but bacteria like Mycoplasma pneumonia can cause it. Environmental irritants, smoke, dust, fumes, and pollution. Chronic bronchitis causes: smoking, the most significant risk factor. Prolonged exposure to pollutants, chemicals, or industrial dust. Recurrent respiratory infections. Cough, often productive, with mucus that may be clear, yellowish, or green. Shortness of breath, especially during physical activities. Wheezing, a high-pitched whistling sound during breathing. Fatigue, due to the body's effort to fight infection or manage inflammation. Chest discomfort, a feeling of tightness or pain. In acute bronchitis, symptoms may mimic those of the flu, such as fever, sore throat, or body aches. Diagnosing bronchitis involves a combination of clinical evaluation, imaging, and sometimes laboratory tests. Clinical evaluation: detailed history of symptoms, including cough duration and mucus characteristics. Physical examination, including listening to the lungs with a stethoscope for abnormal sounds like wheezing or crackles. Chest X-ray. Findings in bronchitis: chest X-rays are often normal in acute bronchitis, but may be used to rule out pneumonia or other lung conditions. In chronic bronchitis, a chest X-ray may show hyperinflation of the lungs, increased bronchovascular markings, especially in the lower zones, thickened bronchial walls due to chronic inflammation. Pulmonary function tests, PFTs, often used in chronic bronchitis to assess airflow limitation. Sputum tests to identify bacterial infections in certain cases. Blood tests may be used to check for markers of infection or inflammation, like an elevated white blood cell count. Treatment for acute bronchitis: rest and hydration, key to recovery. Medications, pain relievers, paracetamol or ibuprofen for fever and body aches. Cough suppressants, used only for severe non-productive coughs. Bronchodilators, for wheezing or shortness of breath. Antibiotics, prescribed only if bacterial infection is confirmed. Steam inhalation or humidifiers to loosen mucus and ease breathing. Treatment for chronic bronchitis: smoking cessation, the most critical step. Bronchodilators, short-acting, for example salbutamol, or long-acting bronchodilators, for example tiotropium. Inhaled corticosteroids to reduce inflammation. Oxygen therapy in advanced cases with significant oxygen desaturation. Pulmonary rehabilitation, exercise and breathing techniques to improve lung function. Vaccinations, annual influenza vaccine and pneumococcal vaccine to prevent infections. Quit smoking reduces the risk of chronic bronchitis and COPD. Avoid pollutants, minimize exposure to dust, fumes, and chemicals. Good hygiene, frequent hand washing to reduce infection risks. Vaccination, regular flu and pneumonia vaccines. Bronchitis is a common respiratory condition that ranges from a mild, self-limiting illness to a serious chronic disease. Accurate diagnosis through clinical evaluation and imaging, including chest X-rays, is crucial for proper management. Treatments vary depending on whether the bronchitis is acute or chronic, focusing on symptom relief, addressing underlying causes, and preventing complications. Thank you for your attention. I'm happy to take any questions you can leave in the comments, share the video, and subscribe to the channel.